Hi, I'm Dr. Charbel Hashul, and today let's talk about something a lot of people wonder about. What does a lump actually feel like on imaging compared to a cyst, and why can't we always tell just by touching it? Here's the thing that surprises a lot of patients. When you or your doctor feels something in the breast, it can be really hard to tell just from touch alone whether it's a fluid-filled cyst or a solid lump. Both can feel round, both can feel smooth, and both can sometimes feel firm or even a little tender. That's exactly why imaging like ultrasound and mammography plays such an important role. Our fingers are good at finding that something is there, but they're not very good at telling us what it actually is. Let's start with cysts. A cyst is simply a small sac filled with fluid. Breast tissue changes throughout life, especially with hormone shifts during the menstrual cycle, and sometimes little pockets of fluid form. Most cysts are completely benign, meaning non-cancerous, and many women have them at some point without ever knowing. On an ultrasound, which uses sound waves to create a picture, a simple cyst usually looks like a smooth, round or oval, dark circle with a clear, well-defined edge. Because it's fluid, sound waves pass through it easily, which is why we often see a bright white area just behind it on the screen, something radiologists call posterior enhancement. This appearance is quite reassuring and one of the most recognizable patterns in breast imaging. Now, a solid lump is different. This could be something like a fibroadenoma, which is a common benign growth made of solid tissue, or it could occasionally be something that needs more attention, like a cancer. On ultrasound, solid lumps tend to look more gray or have mixed shading inside, rather than being clear and dark like fluid. The edges might be smooth and well defined, which is often seen with benign growths, or they might look irregular or blurred, which is something radiologists pay closer attention to. Solid lumps don't let sound waves pass through as easily, so you don't get that bright enhancement behind them the way you do with a cyst. On a mammogram, which is an X-ray picture of the breast, cysts and solid lumps can sometimes look similar, both appearing as round or oval masses. This is actually one of the main reasons ultrasound is often used alongside mammography, because ultrasound is much better at distinguishing fluid from solid tissue. It's a bit like the difference between shining a flashlight through a water balloon versus a rubber ball. The light behaves very differently depending on what's inside. So what does this mean for how something feels when you press on it? Honestly, not as much as people assume. A tense, fluid-filled cyst can feel firm and even alarming to the touch, sometimes described as feeling like a hard pea or a marble. A solid lump might feel similar, or it might feel softer and less defined. This is exactly why self-exams are useful for noticing changes, but they aren't meant to diagnose what a lump is. That part is imaging's job. In some cases, even after ultrasound, there's still uncertainty, and that's when your doctor might recommend a simple procedure to drain the fluid from a cyst, both to confirm what it is and sometimes to relieve discomfort. Or they might recommend a biopsy for something solid, which means taking a small tissue sample to look at under a microscope. These are common, well-established steps, and having one recommended doesn't mean something serious is happening. It simply means your care team wants a clear answer rather than a guess. Here's the practical takeaway. If you feel a new lump or change in your breast, try not to spend too much time trying to guess what it is based on how it feels. Firmness, size, or tenderness alone don't reliably tell a cyst from solid benign from something that needs more evaluation. The most useful next step is getting it looked at with appropriate imaging so your doctor can see what's actually going on rather than relying on touch alone. As always, this video is meant to help you understand what's happening during breast imaging in general, not to diagnose or advise on any specific lump or symptom you might have. If you've noticed a change in your breast, please reach out to your own doctor, who can guide you through the right next steps for your situation. Thanks for watching, and take good care of yourself.